Cass is our midwife who comes in to answer any questions that you have surrounding childbirth and pregnancy. So either give her a call, which is the best way to do it, 08085 92 95 00, or text 80295. And we've got Amanda McKinnon on the line, Cass. Good morning to you, Amanda.
Morning.
Good,
Hi, Amanda.
Good morning.
Hi.
And you're expecting at the moment, Amanda, yeah?
I am. I'm just over 32 weeks pregnant, which for me is an achievement because my son came at 29 and a half.
Ooh.
So I feel like in a way, it almost feels like my first baby because I've never had to pack the overnight bag and I've never been this big before. So
oh, lovely.
It's very exciting, but I'm learning a lot, and I had a big question for your lovely midwife. So, because the only problem that I seem to have at the moment, well, it's not a problem, so I hear, I don't know. She's breech at the moment, and I'm scared about going early, like my son, and I just wondered if there was any advice or tips you had to try and make her turn round.
Well, firstly, congratulations. That's wonderful. I bet you can't wait. As far as baby being breech at 32 weeks, around a third of all babies are breech round about that time.
Just explain to us what that is, Cass.
Breech basically means that instead of baby being head down, baby is bum down. So the easiest way for babies to be born is if they come out head first. Breech babies like to try and come out bum first, or feet first even. So it's a fairly common thing at 32 weeks, and it's really not something to worry about. Around 96% of all babies will turn head down by 40 weeks. So there's a very, very, very high chance that your baby will turn all on its own anyway. If baby hasn't turned by maybe 37, 38 weeks, then it may well be time to have a chat with an obstetrician who may well offer to try and turn the baby for you if that's something you would want, or you can consider a breech birth. But right now at 32 weeks, I wouldn't worry too much. I mean, babies change position all the time. As your pregnancy progresses, I would recommend that you spend some time walking during the day. Now, it doesn't have to be up a mountain or even outside. Even a walk around a shopping centre for a couple of hours really helps baby turn into the position that is right for them. Of course, there are some babies that will stay breech, and at that point, it's really up to you after a discussion with your doctor and your midwife about what you want to do from there on in. My own first baby was breech until 39 weeks, and then I went out and decided to cut the grass, had a lie down, and he obviously didn't like that, and turned.
Really?
And was born 2 days later. So it does happen, and although people will tell you it's very unlikely, like I said, 96% of all babies will turn by full term.
Oh goodness, well I don't think I'll be the weirdo in my street cutting the grass in the winter.
No, but with a 4-year-old, Amanda, I'm sure you've got every excuse to go out for a walk.
Yeah, and I'm
off to the park.
Quite sure that you're
absolutely
bending over and picking things up all the time as well.
all the time, and with school runs and stuff, I'm definitely on my feet a lot. But no, it's really reassuring to hear because the percentage of that is very high indeed.
Yes.
So.
Pretty good,
Yeah.
pretty good.
Oh,
Well, Amanda, I hope that's given you a little bit of peace of mind. I'm sure it has. Enjoy the rest of your pregnancy. What's the due date?
23rd of January. So
Oh, lovely.
Right, lovely.
we shall see.
Yeah.
And listen, what a fabulous Christmas. You're going to be lying on the couch. You're not going to do a thing. You're not going to lift a finger. You're going to be waited on hand on foot.
Absolutely.
I'll be telling everyone that. Thank you.
Yeah, we'll give you official dispensation, absolutely. Amanda, thank you very much for speaking to us this morning. There we go. Oh, I didn't know that. So it just turns round on its own.
Yeah.
Yeah, I could getting in the natural position, I suppose.
Yeah.
Well, there you go. One satisfied customer. 08085 92 95 00. Take your chance to call the midwife, Cass McNamara here. Anything to do with pregnancy, childbirth, and babies. One of the stories I noticed in the news at the moment, Cass, is about more women having babies by C-section. And just when Amanda was speaking there, I was thinking in my head, so what happens, and I don't want to alarm Amanda, I hope she's now switched the radio off, but in the situation, the small number of babies that don't turn and it is a breech, does a caesarean then become a more likely option, or is that no link there?
Over the past, 20, 30 years, it's become very common for women with breech babies to be offered a caesarean section. More recent, because there are some additional risks to giving birth to a breech baby for the baby. However, studies have shown that actually it's not particularly much, there's not a massive advantage to having a caesarean section. What does make the difference, though, is that if you are going to have baby naturally that's breech, that you have people that are experienced and confident in caring for you, because that's really the limiting factor.
Right,
here.
okay. But generally the trend towards more women having babies by C-section, I'm trying to see where this information is coming from. Saying that this is continuing to rise, rose from 34% up from 28% over the past five years. Are these elective caesareans or emergency, I wonder?
I think there has been throughout the world in all developed countries a general rise in the number of caesareans. But I do actually think that a lot of places are now trying to reverse that, because it's, although caesarean sections are very safe operations, it's still safer in if there's no other medical complications for women to have a natural birth. You're, 3 times more likely to actually die having a planned caesarean than you are having a natural birth.
Is that right?
If you don't have other medical complications. I mean, however, most women that have a caesarean, there are very good medical reasons for it. But women just going down the route of choosing a caesarean because for whatever reason they've been led to believe it's safer or easier. Firstly, I'm quite sure MD that's had a caesarean would tell you it's not easier. And it's not true that it's safer either. So, but that has to be balanced with medical considerations as well.
Yeah, I suppose there's a bit of a, whether you call it a contradiction between, and the medical view seems to be that they would rather minimise the number of caesareans.
Yeah.
And yet, amongst chit-chat, there can be the gags around, oh, you know exactly when it's going to happen, you're not going to have to push, you're not going to have to worry about all the kind of yucky things that might happen, and you're out getting your hair done 2 days later, which is often the chat, isn't it?
Yes, that's right. And actually, none of that's true, really. Firstly, you're having major abdominal surgery. That takes time to recover from. You will lose more blood because you've had surgery. Your baby's more likely to end up in special care. It's going to take you longer to recover. You might think that your section's booked for a particular day, but if there are other emergency things going on, then it might not happen on that day. I don't think most women that choose to have a caesarean section do so flippantly or lightly. I think there's a lot going on with people who choose to have a caesarean section, and certainly the fear of birth is on the increase, and part of that is because of the, in the media, everything about birth is portrayed as about the worst thing that could
Scary.
possibly happen to you, rather than an everyday event, a physiological event.
Yeah. Text in, I am in the position where I have one 12-year-old son and I want to have more children, but due to study I'll be 36 when it's a suitable time, and I'm worried about my fertility at this age. Is there a way to check my fertility now to make sure this will all be okay, all being well? There you go. There's somebody who's a very planned and organised person.
Yeah, very organised. There are some companies that you can pay privately that will do an assessment of your ovarian reserve, which might give you an idea of how fertile you are. However, in your mid-30s, you're still pretty fertile if everything is in working order. As you're less fertile in your mid-30s than you were in your mid-20s, and you'll be much less fertile in your mid-40s than you are in your mid-30s. The other thing about having...
But it doesn't mean that you're not fertile.
It doesn't mean you're not fertile. You can check, but actually, what I would say is probably the simplest thing to do is when you're ready to try. And see what happens. You may get pregnant the first month, it may take a year. If things haven't happened in a year or so, by all means see your GP, who may well want to do further tests. It's also important to bear in mind that the age of the father of the baby has a bearing on conception as well. We used to believe that had no impact, but we do know that men over 40 and over 45, there's less likely to be a successful pregnancy.
Okay. But you're not overly alarmed at 36?
No, absolutely not.
Okay. Just a quickie before the news. I had my first son at 28 weeks due to preeclampsia. I was told it wouldn't happen again, but it did. My second son was born at 34 weeks. Is there anything I could have done to prevent this? And if I had another child, would it be likely to happen again?
I think if you, answering the issue around is it likely to happen again, I think if you've had preeclampsia twice, then you are a bit more at risk of developing it again. However, because of your history, you'll probably be very closely monitored through your pregnancy. You've had 2 premature births and had preeclampsia. There isn't an awful lot that you can do to prevent this. It is one of these things that we don't exactly know what causes it. We know that the baby being born tends to resolve the condition, but it is quite a serious condition, and it's one that you need to think carefully about. But certainly don't blame yourself in any way, because it is just one of these unfortunate things.
Okay, and I suppose at least, all the medical team will be aware of the possibility, and that monitoring will help. Cass, thank you very much indeed. Cass McNamara, our midwife. So Helen and Bewley is...